Hello, everyone. Thank you so much for joining us today to review the 2019 QPP final rule. If you didn't know, CMS released an unofficial copy of the final rule on November 2nd. And so while our team here did a great job of reading through the pieces to put together today's presentation, to share with you some of the key points of the final rule. Just keep in mind that CMS will officially publish the final rule on November 23rd. So if you notice that perhaps some of the information in our presentation today is not totally aligned with perhaps your interpretation, please feel free to share any feedback you have with us. Also, I do want to thank everybody for joining us today. Happy Election Day. I'm glad you all were still able to learn about the final rule. My name is Usman Sufder. I am an account executive here at Healthmonix, and joining me today is our communication specialist, Christina Zink. So during this presentation, as I go through slide by slide, if you have any questions, feel free to submit it in the GoToWebinar widget, and Christina will be able to answer them throughout the presentation, and at the end we'll also have an open Q&A where I'll be reading aloud these questions and answers in case they apply to anybody else. Also just know that our company Healthmonix does power a MIPS solution called MIPS Pro. So as you do prepare for the 2019 MIPS reporting year, if you are looking for assistance, if you are looking for a technology solution that can help you report MIPS, just know that MIPS Pro for the 2019 reporting year does open Thanksgiving this year, and our tool will be live for reporting in the first week of January. So now that you all know a bit more about us and our process here, we do love to learn a bit more about our attendees today. So we do have a poll if you wouldn't mind just answering. We're just curious as to whether or not you all have begun reporting for the 2018 MIPS reporting year. So if you wouldn't mind just answering that question quickly for us, we'll really appreciate it, and then can continue with today's presentation. All right, so I see a few more votes are coming in, so I'll just leave this poll open for a few more seconds. All right. So it does appear that more than half of you have already begun your MIPS reporting. You are familiar to some degree with the process and CMS's requirements, so that is great. A lot of our presentation today will, to some extent, be reiterating what you're already doing. For MIPS reporting, for those who have not yet started MIPS reporting or are not familiar with MIPS reporting, don't worry. We'll still be explaining each category of MIPS and everything else you would need to know so that you can be successful with reporting in the 2019 performance year. So back to the presentation. Today we are going to first just look at the biggest changes from the 2019 proposed rule to the final rule. We're going to be looking at changes that will matter the most to most people reporting MIPS. Then we'll take a deeper dive into each performance category before reviewing the final score and submission. And finally, we will have an open Q&A at the end. But like I said, if any questions come up during the presentation, please feel free to submit them to us and we'll answer it as soon as possible. So what's new in 2019? Here are the biggest changes. First, the quality category has once again been reduced in its final percentage of your final score. So it is being dropped from 50% down to 45% of your final score. And eligible clinicians are also now able to submit a single measure via multiple collection types. That 5% that was taken away from the quality category has been added to the cost component of MIPS, which is increasing from 10% to 15%. Both improvement activities and promoting interoperability are still worth the same amount they have been before. Just know that for improvement activities, the promoting interoperability bonus has been removed. And for promoting interoperability, know that the biggest change is clinicians reporting this category must be using a 2015 edition certified EHR technology. If you're still on a 2014 EHR technology, you would no longer be able to report this category. Clinicians would need 2015 certified EHR technology to report promoting interoperability. CMS has also changed their scoring methodology in this category, which we will be getting into further down this presentation. Also, the performance threshold has increased from 15 to 30 points. In other words, the minimum score required for 2019 MIPS reporting is 30 points. Scores below this value would be subjected to pay a 7% penalty in Medicare Part B charges. CMS has also increased their exceptional performance threshold from 70 points to 75 points. So just to reiterate, the minimum score now for MIPS reporting is a total of 30 points. And to at least get into that exceptional performance range, you will need to have a score of at least 75 points. Now you might be wondering who's included in MIPS. There are several new eligible clinicians now able to report MIPS. They are physical therapists, occupational therapists, psychologists, qualified speech language pathologists, audiologists, dietitians, and nutrition professionals. Missing from here is social workers. Social workers are no longer eligible to report MIPS, at least for right now. And in addition to those types I just mentioned, physicians, PAs, nurse practitioners, and other clinicians who have been reporting MIPS are still eligible as well. So there are several new clinicians eligible to be reporting MIPS. However, there are still eligibility exemptions beyond specialty. So if you are a clinician who is newly enrolled in Medicare, who falls below the low volume threshold, or if you are a clinician who's enrolled in an advanced alternative payment model, then you would be exempt from reporting MIPS. And just to review, the low volume threshold is if you bill less than or equal to $90,000 in Medicare Part B charges, C less than or equal to 200 Medicare Part B patients, or provide less than or equal to 200 covered professional services. If you fall below any one of these numbers here, you would be exempt from MIPS reporting. However, new in 2019 is an option to opt in to MIPS reporting. So even if, let's say, you're only billing 70,000 in Medicare Part B, but you see more than 200 Medicare Part B patients, you can opt into MIPS reporting, be able to submit information to CMS in order to not only get feedback from them, but also perhaps earn a positive payment adjustment, earn incentives. So you do have the option to opt into MIPS so long as you exceed one of these thresholds here. Continuing for MIPS reporting are virtual groups, although some of the policies and election processes have changed. So now for 2019, the virtual group eligibility determination period aligns with the first segment of data analysis under the standard MIPS eligibility determination period. So this first determination period is from October 1st, 2017 to September 30th, 2018. So that's the eligibility determination period. For the election process, TINs may inquire about their TIN size prior to making an election during a 5-month time frame that begins on August 1st and ends on December 31st of the calendar year prior to the performance period. In other words, you have until December 1st, 2018 in order to become a virtual group for the 2019 MIPS performance year. And if you do wish to become a virtual group, you would need to have a virtual group representative email the virtual group election to the email address here and send it to CMS by, again, December 31st, 2018. So now that we reviewed some of the biggest changes in MIPS in 2019, as well as which clinicians are included in MIPS, we can go ahead and dive a bit deeper into each performance category. So for quality, which oftentimes does require the most work for MIPS reporting, CMS still requires you select a total of at least 6 measures. Of these 6 measures, one must be an outcome measure, and if you cannot select an outcome measure, you would need a high priority measure. So CMS requires a total of 6 measures. You could have 6 outcome measures, but at least one of them will need to be an outcome measure. There's no limit, but you do need at least one outcome measure or high priority measure. Alternatively, a specialty specific measure set or subspecialty measure set may be reported as well. So just to kind of compare this side by side with 2018 MIPS reporting, as I said earlier, quality is now worth 45% of the MIPS final score. Additionally, whereas in the past, participants could only select one submission method for this category, this year participants can choose to report quality through multiple collection types. So for example, they could go through a registry like us, MIPS Pro, but also submit quality through their EHR system or through claims reporting, for example. There is an additional policy for groups reporting the CAPS for MIPS survey. If the sample size was not sufficient, total available measure achievement points would be reduced by 10 points, and that measure would receive a total of 0 points. There's also another change. Only small practices, and small practices are defined as groups with 15 or less clinicians, may report via claims. So again, if you are a small practice, only then are you allowed to report via claims. Groups with 16 or more clinicians do not have this option available to them. There are also extremely topped out measures, which are measures that have a mean performance within the 98th or 100th percentile range. So essentially, measures that are topped out, CMS is trying to get people to shy away from them, and you wouldn't necessarily be able to score as highly by reporting a topped out measure than you might one that is not. Additionally, some further changes from 2018. There are now 10 new quality measures that have been introduced, and CMS went ahead and removed 26 existing quality measures. So they added 10 more, but they did remove 26 quality measures. So just be mindful of that as you begin selecting your 2019 MIPS quality measures. Also, just be aware that CMS, even though they have added and removed measures, have not released their measure specifications just yet. That wouldn't come until 2019. Moving on to the promoting interoperability category, as in the past, this is still worth 25% of the final MIPS score. There is still a 90-day minimum reporting period. However, a 2015 certified EHR technology is a must, is required to report this category. You would not be able to report promoting interoperability if you do not have one. CMS has also introduced performance-based scoring, which is new this year. So again, just to do a side-by-side comparison, I already discussed the change that there is no change in how much it's worth of your final score. But like I said, you must use a 2015 edition certified EHR technology. There is now also, because of that, one objective and measure set based on the 2015 edition certified EHR technology. While CMS has also introduced two new measures in this category, one is called Opioid Treatment Agreement, and the other is a query of PDMP. On the next slide, we'll discuss in some detail the new scoring methodology, which is performance-based scoring at the individual measure level. So now each measure score is based on the MIPS eligible clinician's performance for the measure, whether they're submitting a numerator or denominator or yeses or nos, and scores for each of the individual measures will be added together to calculate a score of up to 100 possible points in this category. If there are any sort of exclusions, if you cannot report any of the promoting interoperability measures, you can get an exclusion claimed, and then points for that measure will then be reallocated to other promoting interoperability measures. So no longer is it just attestation based. Promoting interoperability measures now have performance scores. Moving on to improvement activities, which is still attestation based. Improvement activities make up 15% of your final MIPS score. There are high weighted activities worth a total of 20 points, medium weighted activities to choose from worth a total of 10 points. In all, groups are required to have a total of 40 points in this category. Unless you are rural, HPSA, non-patient facing clinicians, or small practices, in that event, you would only need 20 points in this category. Also, if you are a patient-centered medical home model, you automatically receive full credit for improvement activities and automatically get the 15% in this category. And so just some side-by-side comparison here, there is no change in the final score. However, the improvement activities inventory have been modified a bit, as well as the time frame for annual calls have been modified. Improvement activity nominations now received in year 3 will be reviewed and considered for possible implementation in year 5 of the program. So that wouldn't be until 2021. And the submission timeframe and due dates for these nominations is going to be between February 1st and June 30th. Also, the promoting interoperability bonus has been removed for improvement activities. Also, just to look at the inventory changes a bit further, 6 new improvement activities have been added, while 5 existing improvement activities have been modified. Of the list of 100 and plus improvement activities, just 1 was removed, and that's the participation in population health research. And finally, we have the cost performance category, which is now worth 15% of the final MIPS score. Cost is automatically calculated from administrative claims data, and the performance period is the entire calendar year. Benchmarks for the cost category come from the performance year as well. And again, to compare it from last year, it has increased and is worth 15% of the final score. In addition to the 2 measures from last year, Medicare spending per beneficiary and total per capita cost. Cost now has a additional episode-based measures, which I'll share with you on the next slide. And also there is a case minimum of 10 for procedural episodes and 20 for acute inpatient medical condition episodes. So on this slide here, you're able to see the 8 new episode-based cost measures. Some are marked as procedural measures and others acute inpatient medical condition. And so you can review those measures here. All right, now that we have dove into the MIPS performance categories, we'll review now the final score and submission process. So the MIPS final score is broken into each of these 4 categories. Quality is worth the most, 45%, promoting interoperability, 25%, improvement activities, 15%, and cost, 15% of the final score. There has been a change to the way CMS applies small practice bonuses. Previously, an additional 5 points, I believe it was added to the final MIPS score. Now CMS is awarding 6 points to the quality performance category. So instead of adding points to your final MIPS score, CMS adds it just to the quality category. Additionally, CMS is weighting a 0% to each of the 4 performance categories, or in other words, CMS is allowing clinicians to be exempt from MIPS reporting if that clinician is joining an existing practice in the final 3 months of the performance period, and that practice is not participating in MIPS as a group, or an eligible clinician would become exempt if they are joining a practice that is newly formed in the final 3 months of the performance period. So clinicians can also be exempt from MIPS if they joined a new practice in the final 3 months of the year that isn't reporting MIPS as a group, or a clinician can also be exempt from MIPS if they joined a new practice, a newly formed practice in the final 3 months of the year. Now, there are three different 2019 transition year pacing options. The performance threshold has been increased to 30 points. Failing to achieve 30 points would result in a 7% penalty. Scores between 30 to 74 points would allow you to successfully avoid the penalty and will also allow you to earn an incentive up to 5%. And scores of 75 to 100 points fall in that exceptional performance range. And here you are able to earn incentives up to 7% with the possibility of additional bonuses on top of that. Now, when assessing penalties or incentives, it is important to note that a provider's MIPS payment adjustment does follow them from practice to practice. It's also important to remember that these scores are posted online on Physician Compare for the public to view themselves. So this year there is a plus or minus 7% payment adjustment possibility. And just know as you look beyond next year's reporting, it's set to increase to 9%. So the financial impact of MIPS is only increasing over time, and that financial impact is tied to the clinicians themselves. All right, now that we reviewed the biggest changes in MIPS for 2019, each performance category and scoring and submission, we'll open the floor for questions and answers. So if you haven't already, please submit any questions you have to us, and we'll go ahead and read some of these out loud. Also, just to reiterate, if you are looking for help with your 2019 MIPS reporting, our registry, MIPS Pro, does open registration at Thanksgiving this year, and our tool will be ready to report and will be live for 2019 MIPS reporting starting the first week of January. So if you are looking for help with MIPS, we can certainly be of some assistance. All right, so it looks like a lot of really great questions are being asked. So I'll go ahead with the time we have left and read some of these questions and answers out loud in case they apply to anybody else who's in attendance. But also just know that you can continue submitting your questions to us and we'll get to you as soon as we can. All right, so one of the first questions that was asked, are there any 7-point capped measures in addition to the measures capped in 2018? This actually won't be determined in the this actually hasn't been stated yet. It will be determined in the 2019 MIPS quality benchmarks, which has unfortunately not been released yet. We do anticipate, though, that within the next month or a couple of months, CMS will release the 2019 MIPS quality benchmarks. And in that list, you'll be able to see all of the capped out measures. We have another good question. Individual reporting via claims is still acceptable for 2019. Is that correct? Um, so that is true. Individual reporting via claims is still acceptable for 2019 MIPS reporting, so long as you are a small practice and have 15 or less clinicians. All right, we have another really good question here. Does the final rule have the list of quality measures that were removed? They in fact do. It is included in the final rule under Appendix 1, Finalized Quality Measures. Here you're able to see the 26 measures that were removed. Included in this list is each measure title, measure number, as well as an explanation as to why CMS removed it. All right. We've also been asked what happens if your EHR becomes decertified? That is a great question. We have been hearing this scenario a lot, unfortunately. In the event that your EHR has become decertified, you are able to submit an application for significant hardship for the promoting interoperability performance category. That way you can get um, essentially be exempt from promoting interoperability and therefore have those 25 points be reweighted to the quality category. So if your EHR becomes decertified, you're still eligible to report MIPS. You would just need to apply for a hardship exemption for the promoting interoperability category. These questions are all great, so please keep them coming. All right, we have a question about exemptions. If a clinician joins a new practice in the final 3 months of the year, how how does CMS know they are exempt and should they be reaching out to the QPP support line? CMS and QPP states the exemption is supposed to be automatic. However, it is best practice to get these things from CMS in writing in case of an error on their end. They had a high rate of error for 2017 reporting, unfortunately. So we always do suggest reaching out to QPP in order to confirm exemptions, and they can be contacted directly at qpp@cms.hhs.gov. Again, you can contact QPP directly at qpp@cms.hhs.gov. healthmonix.gov. All right, so I see some more questions have been submitted here. So just bear with us while we review them and get back to you. But again, keep submitting any questions if they come up. All right, so we have some more questions we're able to answer now. This one is, if we are not eligible for the promoting interoperability category because we do not have a certified EHR technology that is 2015 certified, how easy is it then to meet the minimum of 30 points reporting the three other categories? So it's still definitely doable. You would need, though, to report the quality category in full. And to do so, you would need to have six measures, report on 60% of patient visits in all of the calendar year. So you would need to report quality in full in order to comfortably get to the 30 points and avoid the penalty. And then just to be safe, you can add improvement activities on top of that, which are generally pretty easy to meet and then attest to. It's just that quality category that's going to need a bit more work to ensure you can avoid the penalty. We have another question about 2015 certified EHRs. Do you have any idea if the 2015 certified EHR technology has to be placed by January 1st, 2019? Actually, since the performance period is only 90 days, that 2015 certified EHR should be in place by October 2nd, 2019. So even if you don't have one until later in the year, so long as you have a 90-day reporting period for that 2015 EHR, you can certainly report this category. So we have another question about promoting interoperability. Essentially, the question asks, are small practices exempt from promoting interoperability? So small practices are still required to report promoting interoperability. They would just need to have a 2015 certified EHR technology. So again, just to reiterate, small practices are not exempt from promoting interoperability, and they would need to report this category of MIPS. We also have a question about payment adjustments. Is it new that the MIPS scores and penalties being tied to the provider new this year, or has it always been this way? So MIPS scores and the subsequent payment adjustments have always followed the NPI. So even if you're doing group reporting, let's say that provider ends up leaving the practice, that payment adjustment, whether it's in a penalty or incentives or whatever, is going to follow them to the next practice they join. So the final score and the payment adjustments always follow the NPI. So even though you can report as a group and receive incentives from your group reporting, ultimately the final score follows the NPI. Another question about scoring. Last year we received 100, and yet we were only getting a 1.88% bonus, which was quite below the 4% bonus that CMS was talking about. So yeah, the information we presented today comes from CMS. It comes from us reading the final rule. However, we we do acknowledge that CMS has promised, at least for 2017 MIPS reporting, CMS promised larger incentives than they were able to pay out. This is mainly because MIPS is a budget neutral program, meaning the incentives they pay out only come from groups that end up paying the penalty. And last year for MIPS reporting, a lot of people were really easily able to avoid the penalty, so CMS didn't have a lot of incentives to pay out. While we're cautious to say CMS will be giving 7% incentives, it is likely that the bonuses are going to increase from year to year in the program just because it is becoming more difficult to avoid the penalty. So while the incentives they promise aren't always necessarily true, we do expect MIPS incentives to increase over time. We also got another question about for particular quality measures, what are the codes for submitting them? So once again, information like that for 2019 MIPS reporting won't officially be available until CMS releases the 2019 MIPS quality measure specifications. However, if you still wanted to have a jumping off point to prepare at least, you can feel free to refer back to 2018 quality measures, just so you can be prepared. And again, 2019 MIPS quality measure specifications won't be released by CMS until the next couple months or so. All right, so just a reminder to everybody, we do have 15 minutes left for today's presentation. So if we are unable to answer your question today, we surely will be following up with all of our attendees and all of our registrants. But if you did want to speak with somebody directly, you can feel free to reach out to us and we'll be more than happy to help out. And if you don't know, the Healthmonix team can be called directly. Our number is 888-720-4100, or any additional or future questions can be sent to webinars@healthmonix.com. So just again, if you don't get to your questions, feel free to give us a call. The number is 888-720-4100, or we can also be emailed at webinars@healthmonix.com, and we'll be more than happy to assist in any way that we can. But back to the questions. Um, if a clinical nurse specialist sees some of her patients under the physician's TIN, but others under her own, how would she report for 2019? So I do just want to say, if there is a provider who's not billing Medicare directly, not enrolled in Medicare, they wouldn't be eligible for MIPS reporting. They would just be exempt. If they are doing a combination of the both, their eligibility really depends on how much they bill to Medicare as an individual provider, but also if you're reporting MIPS as individuals or as a group. So that question does depend on a couple of factors. So we have a question more so directly related to our registry, MIPS Pro. If we are going to access your services for QPP reporting in 2019, when do we need to enroll? So MIPS Pro actually is really able to allow users to enroll until the final day of submission. So although we don't encourage that, our MIPS Pro is always able to work with people last minute. However, we do encourage anybody looking to do 2019 MIPS reporting to get started as soon as they realistically can. MIPS Pro is open for registrants Thanksgiving of this year, and our tools officially live for reporting first week of January. So if you want to be on top of it, definitely encourage everybody to get signed up before the end of this year. Back to questions about reporting requirements. Is MIPS only 90-day reporting? Did they remove the option to submit a full year? So MIPS is only 90 days for improvement activities and promoting interoperability. The quality category is still a full year, and the cost category is still a full year's worth of reporting. We have another great question as well. We are new to MIPS. We see 95 Medicare patients, but bill more than $90,000 and think we would be over the 200 services. Do we report MIPS? So in this situation, you would be below the low volume threshold and therefore exempt. However, you do have the option to opt into the program, and by doing so, you can certainly try to get some incentives. All right, we have another great question. Is it true that newly eligible clinicians for 2019 are exempt from the promoting interoperability category? If so, do we know when they may be required to start reporting the promoting interoperability category? So, yes, new clinician types are in fact exempt from promoting interoperability, such as psychologists, physical therapists, occupational therapists, etc. We currently at this time do not anticipate that they will become required to report PI, just because for a lot of these specialties it's not relevant. There is some discussion supporting this assertion in the final rule, although nothing is certain. The only thing that is certain right now is that newly eligible clinician types, like psychologists, for example, are exempt from promoting interoperability, and that score gets reweighted to the quality category. So I'm actually really glad that question was brought up. All right, so we have another question about our registry, MIPS Pro. If somebody has a 2018 account, but they didn't purchase licenses for 2019 reporting in January, um, essentially what happens? So while we, MIPS Pro, encourage users to get signed up before 2019 actually begins, at any point in the year, um, or even prior to submission, we are able to accept new users. If you aren't able to get started this year, don't worry. You can certainly sign up with MIPS Pro as the year progresses. Also, just as a reminder, the today's presentation is available in the handout section, but also we will be sending a follow-up correspondence to each registrant, and included in it is a recording of today's presentation as well as the handout once again. All right, we have a great question about newly eligible clinicians. Now that physical therapists are included as um, eligible providers, eligible clinicians, will there be more resources regarding how to successfully report in this field with limited reporting options? So CMS still does have measure sets for these specialties like physical therapy, like psychologists, and so on. Our registry, MIPS Pro, also does have recommended quality measure sets for each one of these specialties as well. Um, so I know QPP has their generalized resources for everybody to use. I can say that for MIPS Pro, our team's definitely able to provide a bit more assistance for groups that are new to MIPS, and we can definitely help them strategize for 2019 reporting and assist in any other way we can. And just a reminder to everybody, we only have 5 minutes left. So once again, if we do not answer your question or if anything comes up, feel free to contact our team directly. Um, you can see our email address on the slide, webinars@healthmonix.com, but also feel free to give us a call. Our number is 888-720-4100. We're more than happy to help out and learn a bit more about what your MIPS situation and experience looks like. So we'll still continue answering questions as they come in um, until the end, which is 4 p.m. Eastern. So we have a really great question about essentially, how clinicians are able to earn credit for some of these MIPS measures. So there are oftentimes scenarios where, for example, a nurse or medical assistant is documenting certain information in the electronic health record or electronic medical record, so long as the MIPS reporting clinician has access to that documentation, for example, of a medication list, and they're able to review it and check off that they have reviewed it. Then that is certainly a MIPS measure that the clinician is able to earn credit for. So even if they're not the ones necessarily documenting a piece of information, so long as it's there and they have access to it, they have earned credit for that quality measure. We also have a question about eligibility. Is the $90,000 the minimum, the total sum of our charges that year, or the total amount of Medicare allowable charges? Um, So essentially, the $90,000 is during the MIPS eligibility determination period. If you are billing Medicare more than $90,000, then you could potentially be eligible. So it's about how much you bill during the determination period, which goes from which really goes from September 2017 to October 2018 for the 2019 MIPS performance year. Um, so we just have a minute left. I don't know if any more questions are going to trickle in. But before this ends, I once again really want to thank everybody for joining us today as we discuss the 2019 final rule with you. Um, and I just want to once again thank everybody for asking really terrific questions and detailed questions. If we weren't able to help you, we'll certainly be in touch. But if you want to talk at your convenience as soon as you can, feel free to contact us directly. We're more than happy to help out in any way we can. And also just know that if you do need a tool to report MIPS, our registry, MIPS Pro, will be live the first week of January. Thanks, everyone.